the shaking, the nervous energy. You need your calm, familiar friend. So Elite is here again. Everywhere you dream, everywhere there's a team. There's a team that's keeping you sleeping. Everywhere you dream, everywhere there's a smile. There's a smile from somebody who sees you. When you need dental work, but you've got anxiety, Elite Anesthesia will put you to sleep. Everywhere you dream. Everywhere you dream. Everywhere you dream. Everywhere you dream.
All right, hello everyone, and welcome to episode 5 of The Dose. We made it this long. He's Sean, I'm Nick. Sean, how are you?
I'm doing well.
It's this tan I see on your skin here.
Yeah. Found myself in Hawaii last week. It was nice.
I knew you were out on PTO. Didn't know where you were going until on TikTok. I saw a video of you riding a mechanical bull at a bar down there in Hawaii. What was this about?
You know how they do things in Hawaii? Lots of mechanical bulls.
That's a beautiful thing, man. Well, I'm glad. It's good to have you back. The dose is late because of you being gone, but we'll excuse your absence. I think this will be good. We're sitting now, settling into the dose a little bit here. February, good month. Perennial short month. There's 28 days. We serviced patients in 13 states, February. 52 providers did cases, just shy of 700 patients and their families were treated. And again, over 2,400 hours in February. As we compare that February to February of 2025,
A year ago,
we saw 48% growth year over year.
Yeah. Yeah. On a short month. It was a good month.
Provider of the month this month, Ben Stevens out of Denver. Ben's a CRNA in Denver with us. He's been with us about a year now. Ben is a kind of walking 5-star review. Offices love him. Gets rave reviews. I mean, we have great providers everywhere. We have great providers also in Denver. New offices, though, rolling Ben into those offices, you can kind of count on an A+ experience being delivered. One thing about Ben is he lives in Fort Collins, which is about an hour north of Denver. Mm-hmm. How we all called this Denver, I don't know how that happened.
You mean Colorado?
An hour north of Salt Lake has never been called Salt Lake, but somehow. And we do cases south of Denver a lot. Yeah. Ben is everywhere, always willing to help, always willing to make it happen. Plenty of nominations for him, well earned. Ben, your gift is in the mail. Keep it up out there. Really appreciate all our work.
I didn't know Ben personally, but his reputation of good clinical care, being well liked in offices, and especially being willing to kind of go everywhere that Colorado asked him to go is Denver. Denver. Sorry.
Yeah, he's just in Denver.
That reputation has preceded him.
Yeah, so. He's done a really good job. Yeah. So thanks, Ben. Appreciate it. Congratulations. Believe it or not, the sponsorship and the line of sponsors trying to get a slot inside of Doze, they feel like the Super Bowl. But we have a new sponsor. Excited to hear from them. Take a quick break to hear from them. Good evening, America. I'm Tom Burgundy. No, not that Burgundy, the attainable one. Are you an anesthesia provider rolling into dental offices like a pharmacological ninja? Do you have so much gear that you show up to an office looking like a yard sale with legs? Well, buckle up those butt cheeks, because today I have news to report. News that is more earth-shattering than the moment my wife suggested to me I go on a GLP-1. She said it with love, but it cut deep.
Tom, can you stop crying like that? It's making you look puffy.
I am puffy, Greg. In any event, the good news is today's program is brought to you by these incredibly thick Milwaukee Packouts. That's right, folks. These bad boys are stackable, lockable, and tougher than my first 3 attempts to grow this mustache. We don't talk about 2009.
Tom, just... If you finish the line, we'll go get ice cream after.
That click you hear, it's not plastic. It's the sound of sultry, succulent, seductive, succulent sedation. You're definitely gonna want one of these toolboxes in your toolbox. The Milwaukee Pack Out by your side, you don't just bring skill, charm, and unsettling eye contact to your dental procedures, but you bring an entire surgery center in a box. That's right, we've got medications, monitors, airway equipment, backup medications, and backup medications. Because as we all know, the motto here at Elite Anesthesia is be prepared.
That's Boy Scouts of America.
No, that's do a good turn daily.
Also Boy Scouts.
Get off my cheeks, Greg. These here pack outs, everything's organized, everything's secure, and just how you left it. Little pro tip, always leave a sweet little treat for yourself.
Tom, I don't think...
Why does my apple juice taste like baby formula?
You put apple juice in a flask?
It's refined, it's elegant, it's how leaders hydrate.
Why do you know what baby formula tastes like?
Now I know the two things that you're thinking. First, these bad boys only fit in big Sprinter vans like the one my older brother Ron has. Not true. Even the micro vans do the job. The second thing you're thinking, how'd old Tom afford one of these shooting promo videos? Well, bought it with the settlement money for my last divorce. I tell you what, I'm glad I did. She fits like a glove. I ride in style, just like the Milwaukee Pack Out. I got patients to go, places to see. My patients see me roll up in this, they feel happy. They feel safer too. So that's right, folks, a Milwaukee Pack Out. So you don't have to carry around your equipment like a caffeinated raccoon. You pack it, you stack it. Until next time, I'm Tom Burgundy. Stay sedated, America. Also available for weddings and bar mitzvahs.
No, you can't say that. I hate this job.
Fine folks in Milwaukee Pack Out, huh?
Grateful to have them.
Yeah, they're great.
We've done it with others and not as well.
I mean, the folks over at Propofol were great to have us.
Also good people.
Yeah.
Couldn't do it without them either.
No, I suppose not. But the Milwaukee partnership's been great.
It's been
good people over there. Curious to see who's next. There's a lot of people.
It's a long line.
Yeah.
Yeah, we'll see who we pick.
Regular programming still to come. We have a provider spotlight, CRNAs of ours out of Oklahoma City. We have an Elite in Action segment video coming from San Antonio, which I thought was pretty cool. And then our regular clinical topic of the month. Casey's got something dialed. I don't think the 3D printer was used for this one. Like you did last time, 3D printing a trachea. You know, he's a busy man.
Yeah. We can't 3D print everything.
Our 3D printer is a busy man. That's what I meant.
Oh, yes. True.
Yeah. Hope you enjoy. Welcome to OKC, another provider spotlight. I'm here with
Jeff.
Jeff Henry.
Yes, sir.
Jeff, where are you from?
From Oklahoma.
Yeah,
Southwest Oklahoma.
Nearby. All right. True or false? Oklahoma State is the best athletic program in the state of Oklahoma.
It's nice working for Elite. Thank you very much.
Consider this your 90-day
I'm done, yeah.
resignation?
No.
Good. Jeff, how long you been a CRNA?
8 years.
And you've been with Elite over 2, right?
Just over 2.
What is a meaningful experience that you have doing mobile anesthesia with Elite?
First case at a Stillwater office, Down syndrome patient. The previous anesthetic provider canceled because they're Down syndrome. I went in there and did it. As soon as I was done, I got a text message from the parent with the kid smiling. First time I've seen the kid smile in 20 years.
Yeah.
So that hit pretty good.
That was your first case?
At that office.
At that office.
But it was month 2.
Wow.
Yeah.
How cool is that? That's
Yeah.
awesome. How do you approach stressful situations and cases? What helps you? What's a tip you'd give somebody coming into this?
I will take any tip I can get.
Yeah.
I just duck on the water. I just try to stay as cool and calm as I can for everybody around me because they don't know what's going on at all. It's fun.
Same way with me and my spreadsheets, you know?
Exactly.
Just stay calm. You'll get through it.
Exactly. Head down.
Switching gears a little bit.
Okay.
What is your go-to karaoke song?
I don't sing anymore.
Well, if you had to do karaoke right now.
Any Shania Twain song. How about that?
Oh, that would be great.
Yeah.
I really hope we get to see that one day.
Never. You gotta get me drunk first.
Last one.
Yes, sir.
Unnecessary skill that you're weirdly either proud of or good at? It's a weird
I'm not
thing.
good at anything.
Oh, come on. You're good at being understated. That's unnecessary.
Man, yeah.
What's a weird thing
Sarcasm, does that count? You never know what's right and what's wrong, what's true and what's not.
Yeah, it's kind of like this interview. I think
Exactly.
you actually love it.
There we go. Yeah.
Jeff, thanks for doing this.
Thanks
Really
for
appreciate it.
Thanks for having me.
Before anesthesia came in, I felt like my patients love me as a provider, but I'm finding that when anesthesia comes in, they still my patients in that they become their favorites, right? And so I feel like it's impacted my patients nothing but positively. They want to get more stuff done. They enjoy the interaction with y'all's doctors. They're super great, super caring for my patients, and so the collaboration has been great. It's definitely helped me, break an obstacle for my patients to receive treatment. A lot of them, they suffer from anxiety. Most people don't enjoy being here at the dentist, right? And so it has allowed for me to provide a service that I wasn't able to provide before. Nothing on my end, really super simple. It didn't require for me to get all these licenses, and the equipment itself is over like 20,000 plus, right? And so it's made it very easy for me, and it's allowed for me to provide more services. It's allowed me to focus more on the dentistry, right? I don't have to be concerned about, checking on the patient because of maybe anxiety related, hiccups, if you will. And so it allows me to just focus on the dentistry, allows for me to build a system that I can get the most out of their time and my time while my patients are here. I'm in constant communication with the elite team. It's a collaboration system that we operate under, and it feels like we're just meant to work together. It's super simple, like I said, no issues whatsoever. They take care of my patients as if they were their own, and collaboration, if I had to put it in one word, is what I enjoy the most out of my experience with them. Most patients would like to have an experience such that they don't even remember what happened, and they just come out with a smile, with a healthy smile. And so again, it goes back to making the best out of their time here. Should every patient be offered that service? I believe so, just because patients don't know what they don't know. And so it is my job to educate them on all the services that we could provide. And you'd be surprised, most patients would say yes, and most patients would actually like the fact that you offer the service.
Hello everybody, KC Stratton. I'm here with our next clinical insight. Briefly, we're gonna go through an equipment rundown of our glucometer. First, what we're gonna start with though is a quick reminder for those markets who have our clearance team, our preoperative nurse who's helping us gather this information. Just a quick reminder that Elite and Natalie, our pre-op clearance team, they're not clearing patients for us. So as a provider, I'm going to clear all of my own patients, but they can help facilitate that documentation, the paperwork, the tests, the labs, whatever we need, they can help facilitate that information so we can make that appropriate decision. So be active on your Google Chats, which is how we're communicating right now. Make sure that you're following up in a timely manner. This only helps avoid cancellations and keeps your schedule open for a patient if there's one that really doesn't qualify for general anesthetic in an office. All right, thanks for your help on this. All right, today we're gonna review our glucometer. So very simple process, but worth a review. These are the components that come in your package. If you have not opened yours, I do suggest doing it. Each one of these items comes individually wrapped in plastic. And so again, just to make it a cleaner experience, open it up, take it out of the packaging, and maybe run through one of the tests. That's what we're going to do today. We're gonna run through a test to make sure that our glucometer is functioning. So you will need to add a battery to it, which I've already done. And so this is a backup AAA. The first thing that I'm going to do is I'm going to load this with a lancet. There is a portion here that has an arrow on it. You twist it to unclick, and then it comes off. These do go in a particular way, so find which way works. Press down to load, you will see an orange light that indicates that it is loaded. And then I would recommend taking off via twisting the safety cap at that point. Put the lid back on, snap it in place. The gauge at the top is how deep of a poke you will make. So if you're dealing with a pediatric, you obviously could go much lighter. If you're dealing with an adult patient who has been poked a lot, you might need the highest setting. Okay, set that aside. go ahead and turn on your glucometer. Once this is loaded, that is when you are going to apply your test strip. Okay. I have seen people who have taken the test strip over, poked the finger, and then brought the test strip over to the glucometer. That will give you an error every time. Okay, so turn on your glucometer. Once it loads, add the test strip, and this is when we'll go poke the patient, take your device, apply it firmly to the finger, and then click the button. You hear the audible. If for whatever reason you needed to reload or do it again, you could pull the back, reload, and do a second if necessary. Obviously, same patient. Okay, 1 needle per patient. Once you have blood on the finger, go ahead and apply that to the test strip. We'll give you a countdown and then apply you with the blood sugar. At that point, go ahead and discard all your items. The lancet probably needs to go in the sharps, so be wary of that. And that is a simple rundown of our glucometer. Thanks, everyone.
Good stuff. I like those segments. You're all so kind to participate in them. These elite and action moments are hard to get. They're a little awkward, getting people in front of camera. There's cool stories happening everywhere. If we can capture them, let's do it. Let's share it.
They make a big difference.
Yeah.
Yeah, I think I've worked for a lot of hospitals, a lot of surgery centers, a lot of anesthesia groups.
Back when you were a real clinician.
Yeah, back when I was a real clinician.
Jeez, those were the days.
Those were the days. But what I found at Elite that I've never found anywhere else is our ability to actually be purpose driven.
Yeah.
In a way that it doesn't exist in a hospital or a surgery center. We're doing something new that's enabling procedures and closing care gaps that have never been closed before. And that's a cool thing.
Yeah.
And the more we can highlight that, the better.
Yeah, totally. 2 announcements before we end. One, Ed Mackey has recently joined Elite.
Mm-hmm.
He is our VP of Provider Recruiting. Ed is 15 years of history recruiting and hiring doctors, CRNAs, the whole bit.
Yeah.
He was at a big HCA hospital for 10 years and then at another surgery group for 5. He just joined us a few weeks ago. You'll all get to know him in some way or another, not the least of which is through recruiting concepts that he has in mind, referral bonuses and programs and things of that. So welcome Ed to the team. We're excited to have him. Secondly, Dozy. I think everyone's seen it sort of in some way, shape, or form. It will change everyone's day to day, and I mean everyone's, by the time we record the next episode of The Dose.
Yeah, it's happening quick.
We've already changed the whole patient experience. They're interacting exclusively through Dozy. The provider experience is the next domino to drop, where the provider will be interacting with his or her schedule and payment stubs and patient information. All the things you need to be a provider will happen through Dozy.
Yeah.
And then the offices will even start interacting through Dozy. That's going to be a step further out, but this provider kind of operational change is about to drop. It's been well tested and well received. We have probably 10 or so providers that are mostly working inside of it right now in its final stage of piloting. The feedback's been very positive.
Yeah, working in a limited version.
Yeah.
A lot of features to drop over the next month to make it complete. Couple months really.
Yeah.
But yeah, feedback seems to be really positive, and it's hard to run this business, hard to do office-based anesthesia without it. It's been kind of revelatory for us.
Absolutely. And so, we'll do our best to be instructive about how to use it and what changes and how it changes. Please, please, please watch the content and the material that we create and support for you all to sort of get an understanding of how it works. We don't want anyone to be confused. Frankly, one system is a heck of a lot less confusing than 4. Mm-hmm. So we haven't had this be a big learning curve, but please take the time to get familiar when the time comes. But no other announcements for me. We did it.
We did it. Yeah.
Episode 5.
Episode 5 in the books.
He's Sean. I'm Nick. See you next time.